everyone, I'm Susan Collini, and this is our monthly roundtable at the Renaissance Center for Plastic Surgery and the offices of Francis J. Collini and the Collini Laser Clinic in Age of Innocence. So besides it raining outside, today is Cinco de Mayo. I should have had something a little bit more frilly on instead of my baseball cap. Last month I think I tricked everybody with my sunglasses, so today it's the baseball cap. So I hope everyone has some fun plans for this evening. But before those fun plans, we have to talk about something a little bit serious. So I'm going to introduce our panel. We have two empty chairs because they are going to be here momentarily. They are finishing with some customers, so we didn't want to be late for our 1 p.m. appointment with you. So I'm going to start over here with Ronnie. Ronnie is one of our medical assistants in the Renaissance Center. And to my left, your right, is Marley, our physician assistant, and then one of our estheticians is Ashley. Hi. And missing, and will be here momentarily, is Derek, head of our laser clinic, and over here, our other empty chair, is Karen, one of our nurses. So today's today's topic is skin cancer awareness. So I'm sorry I'm tripping up because we're going to talk about skin care that also has to do with skin cancer and to make everyone aware of what they should be looking for. So we're going to start talking, we're going to break down our little round table into a few sections. So we're going to talk about first early recognition, because I think that that's really important so that people are aware of exactly what they should be looking for. Then we're going to have a little section on prevention, a little section on help, and then we're going to talk about products that can help with cancer, skin products, aging, all those good things. So I'm going to start, since we're going to start out with the medical aspect of early recognition, I'm going to turn it over to Marley, since she's our physician assistant, and she'll give you some things that people should be aware of and some of the things that we look for when we see patients in our office. And then we'll also go back and forth a little bit with Ronnie, because Ronnie's right in the trenches there and helps doctor with removal of those lesions and what we do with them after the fact. So I'm going to hand it over to you, Marley.
So skin cancer is the most common cancer in people in the United States. So that right off the bat, that's important. We should all be aware of signs of skin cancer. And a really good acronym that we use is the ABCDEs of skin cancer. So any lesion, meaning any mole, like mark on your skin, we always want to keep an eye on and monitor. And to follow that acronym, first the A stands for asymmetry. So if the lesion, the mole, is asymmetric, meaning part of it is different, one half is raised, the other half's not, or it's not round, it's not like a round mole, it's kind of more of a splotch. That's an indicator that it is suspicious, possibly for cancer. Then the B stands for borders of the lesion, and that means, so if it's just a mole, just something benign, not cancerous, it usually has, well demarcated, smooth borders, like a circle. But if it's something that's more worrisome, it usually has we call scalloped edges, or it's like a lacy pattern. The edges are really irregular.
Yeah, poorly defined.
Yeah, poorly defined, right? Yeah, and then the C stands for color. So any lesion that is multicolored, that's always kind of another red flag. If it's all uniformly one color, it's usually not as suspicious as if you have a lesion that's black in some spots, brown in some spots, bluish, pinkish. Skin cancers can also have those colors as well. Red,
yeah,
too.
go through all the colors.
Yeah,
I think
reddish,
that's unusual, because I
yeah.
know that was always something for me that was unusual.
Dry and flaky, some people will say.
Yes.
Yeah.
Right. And then the D stands for diameter. So any lesion that's larger than 6 millimeters, which is about the size of a pencil eraser on the tip of a pencil, that's something, being that size or greater makes it suspicious that it could be a skin cancer. And then
Or move into a skin
Or-
cancer,
yeah, or
because I
move
know
right
that
in.
I've always heard doctors say that, you know, it might not be a skin cancer, but the larger that they get over time, the more they're brewing, so to speak, I
Right,
think.
which leads us to the E, which is evolution. So any lesion you have that appears one way and then over time it's getting larger, it's changing color, it's changing shape. That's a huge red flag that you wanna get that checked out, that could be a skin cancer, for sure. So that's the quick little summary of if you have any spots on your body, you know, you should always be aware of anything. And if, you know, a lot of times skin cancers are common on the back, from people from sun exposure, so it's helpful if you have a family member or friend who can just kind of keep an eye out for you, especially if you have a, you know, one lesion in particular, to just keep monitoring. Here's Derek joining us
Oh, here we come
now.
with Derek. He's coming up from the clinical realm with his
Hi,
mask.
everybody.
We can take our mask off, we're
Sorry,
all
everyone.
vaccinated,
Yes,
there we
we
are.
are.
Hi Derek, we did introduce you, so
I ran a
actually,
little late today, sorry.
you're perfect timing, so we just went through the ABCDEs of
Perfect.
recognition.
Yes.
And so now at this point, we're gonna talk about help. So the help is, I wanna introduce that to you to
Sure.
review, because you're gonna talk about all the things that we can do, or patients can do,
To help themselves.
for prevention.
And one of the, I don't know how far you got into the ABC, but one of the things that I think sets us apart a little bit in our neck of the woods is that we have estheticians that are trained to recognize these things, and they are trained to see the early signs of it, because we do have a lot of ways of removing those brown spot pigmentations or things that are unsightly, but sometimes those are your warning signs. So just like she talked about the ABCDEs, if we go in with a laser to help you get rid of that brown pigmentation, we might take away your warning signs of a melanoma or a cancerous lesion. So we really set ourselves apart in being trained in recognition, and also having Dr. and Marley and other medical professionals on board for us to bounce those things off of, and they can
Right.
come upstairs and we'll get it okayed for you
Yeah, we
pretty
have,
quickly.
we have instilled that whole philosophy with our team, so that there's ever any question, you know, we're right here, we have direct medical access, and we can do that for you, because I know that there are all kinds of places that, you know, do skincare or have facials or lasers or different things like that, but we are also that one extra step in helping
Medical
you, or
facility.
helping you decide that there's something, an issue of some sort.
Because even like a chemical peel is capable of taking away, so you can go to a spa and get a treatment and they can take away those signs. But where the help is, so if we are able to clear you, and that's not something that's an issue for you, we have a plethora of lasers.
I love that word plethora.
We have a plethora. So we have lasers that work with heat-based light, which is called intense pulse light therapy. You might also hear it as BBL, broadband light. That's great for your lighter skin types. So that's something that's going to go in and it's going to coagulate pigment with a very bright, hot light. So if we find out that it's not a problem, we can go in and take those brown spots, liver spots, redness, all of that away with one of those machines. Now we also take it a step further if you are a dark skin type. That is a very difficult person to treat, because a lot of these lasers, they'll go after melanin in the skin, and that's what's responsible for your dark pigmentation. So we have some different lasers that work with either pressure waves, or it just evaporates the skin pretty much without damaging the melanin, to take out the pigmentations in a darker skin type. And for people who don't even want to get into that realm, we have chemical peels that are capable of getting rid of a lot of pigmentation. But the most important thing for you to do is your at-home care, because you're seeing us 12 times a year possibly, and you're taking care of your skin 2 times a day. So we have another plethora of
A variety.
we have quite the variety of different skincare, to include ingredients like hydroquinone, because we're a medical facility. So we're able to go in and formulate our own hydroquinone as a bleaching agent. So you could also take it home and do this at home. We have some arbutin, vitamin C's, and a lot of different products that work together for prevention and removal of dark spot pigmentation.
Super.
Yeah.
Now, when we get to that part, so we kind of went around a little bit and we
Sorry,
went, that's all right. So, no, that's what I'm here for, keep us all on track. So we talked about the lasers because that's a good way in which to just have somebody else looking at you before you go to the doctor. So let's just say now we've decided that there is something that might be cancerous, then we make an appointment with the doctor.
Yes.
And Ronnie works, and Marley work
Yes.
very closely with Dr. Collini in excising lesions and determining what is, must be removed. So explain a day when we get a patient that goes
Oh, yeah.
back to the treatment room for a lesion removal.
Of course, something, so the nice thing about this place is we do enough of them, so we know what we're looking at. We are going to get you in the best situation to get that off. So it's nice, you come to the office, we will numb you. It's just like getting numbing at the dentist, it's quick, it's not that bad. And once you're numb, you're golden from there. We excise the lesion, we take it out, and we send it out to pathology. And that's probably one of the most important things is we're sending it out and we're finding out what it is. And usually we have those results back in a week.
Right, and
Get a
lesion
definite
removals,
answer.
Yeah.
lesion removals are covered by your insurance. I haven't seen issues, I happen to work a lot with the insurance companies, so that's one thing that appears to continually be something that insurance decides they wanna pay for at the moment. So, we're always at their beck and call, but that is something, if you have any concerns at all, because sometimes patients think a mole is a beauty mark and that it's cosmetic in nature, when in actuality, any lesion that could possibly be suspicious or, irritating, if you have something that's irritating, that's getting rubbed on your neck or different things, you should come in and see us and talk to us about that possibility. So, that's the office side. So, that's, we talked a little bit about the sunscreens, but we think that the sunscreens are really important, and we know that we have multiple types of sunscreens, and they're physical blocks, and
We can
there are
talk about
chemical
that.
blocks,
Yeah.
and I think, Derek, you wanted to
Yeah.
mention that with the sunscreens again.
So,
Before we
Sorry.
talk about the sunscreen,
Yeah.
could I just add a little bit
Yeah,
more
Marlon,
about
Marlon.
the lesion excisions? Sorry, Derek.
no, I love to hear it.
Because with the, like Ronnie said, we'll be sending out the lesion to pathology, so there's a trained, pathologist, a doctor who looks at it under a microscope and will tell us exactly what the lesion is, what type of cells they are, and it tells us if all of it was excised out, which is really important.
Oh,
So
that's
that
really
way,
Yes.
yeah, so that, and Dr. Klingme's really good at taking out, wide enough margins, we say, so that, usually it's very rare that he ever has to go back and excise more, which is something else that I think sets us apart, from other offices, dermatology practices, where often you get a biopsy first, which is that they just take a little scraping of the lesion, and then they send that to pathology, and then depending on those results, then you either have the lesion completely removed or you just can let it go. But the nice thing about here is, and so that involves two procedures, you have the biopsy, and then if it is something cancerous, you have to come back, have it removed, whereas
Yep.
here, you just have the lesion removed, we get the results back, we know exactly what it is. Best case scenario, it's nothing bad at all, and you have that, that lesion that's probably
The
unsightly,
yeah.
removed anyways, and then, worst case scenario, we get it back, it was cancer, but it was usually completely excised, and then your cancer's gone. And the thing with skin cancer too, that just early recognition is so important, because most skin cancers, if caught early, and if they're fully excised, you're gonna be okay. But when they're left to go, especially melanoma, it can metastasize, and then,
You're in a lot of trouble.
yeah, so that's why skin cancer recognition is just so important. And anything that you just are, any lesion, it's always okay to just come and get it checked by us. Like, we have tons of patients who come who just have lots of pigmentation, lots of lesions all over, and sometimes they'll come in, every couple of months just for like a
That's
skin
good.
check, and
Body
that's
check.
completely fine to do.
Yeah, body check, that's.
Yeah, and just, hey, like, this is changing, just like, so.
And even if, that lesion does come back and it isn't nothing, again, we're watching for the ABCDE, so that could potentially become something in the future too. So having it
Yeah.
taken care of and just
It's
out of your way,
removed, yeah.
it's great to just not have to worry.
Right,
Exactly,
every
yeah.
once in a while, I'd say for the majority, we get, when we excise them, it's completely
Yep.
gone for good. But occasionally, something is so deep and that I've seen it once in a great while that they can, start to grow again. And if that ever happens, that's another indicator that you should definitely have that removed and we need to get
Yeah.
a little bit deeper. It's occasional, but very rare, but it can happen.
And
And we didn't talk about the 3 types of cancer, so we have
Yeah.
basal cell, we have
Squamous
squamous cell, and we have melanoma. So there are different types. The basal cell are the ones that, God forbid, if you have it, it's not, it's very slow growing. You can have them for years and they're not instantaneous, but once you start to get into the squamous cell, they can get very large and very unsightly, and melanoma is the one that's very deadly. And unfortunately, I can tell a quick story on that one. My mother-in-law was, we were at a softball game at my daughter years ago, and Dr. Collini happened to just lean over to get a soda next to her leg and saw a little dark spot on the leg. And ironically, my father-in-law is a physician too, and had been telling my mother-in-law for years, oh, it's fine, there's nothing wrong, it's nothing. And Dr. Collini said, I think we need to look at that, when you come back up, I want to excise that, and sure enough, it was melanoma. And he had to do actually a major reconstruction on her knee, just because, and it's just the littlest dark spot, and it doesn't look like anything, but I have to say, he's so good at, he picks up so much, it amazes me. I guess just the experience is very critical.
Yeah,
Yeah.
anything you're curious about, have it checked. And the other thing is that cancers can present themselves in a lot of different ways, and I'm sure you discussed that earlier, but
I didn't talk
the
about
redness and the flaking
Yes.
and so
Yeah.
some people have this idea that you're just gonna see this brown pigment and it's gonna very apparently be a cancerous lesion, like you have this idea in your head. And I could speak about my grandmother with this. She had all peeling skin down the front of her legs. She was a sun worshiper, which we'll get into prevention. And I said, you have to go to the dermatologist. It was bugging her, and it was squamous cell. So it's very red and flaky and peely, and someone could almost think it's like an eczema or a
Yes.
psoriasis type deal, but that's
Yes.
also how cancers present themselves in any way like
And
that.
basal cells sometimes also can present like an ulceration, and squamous cells sometimes like that too. So like you said,
People think
not
of it
here-
It looks
blemish.
odd.
Right,
Yes.
yeah, people
They
like
look
they think
angry.
yeah,
Yes.
or they'll you think just like a dark spot, oh like that's what skin cancer is gonna look like, but it could be just people think, oh I nicked myself shaving,
Yep.
and then they're like, this just won't go away, it's been 8 months now, and oftentimes that sometimes is how a cancer will present
Yes.
too. It's like a little nick or something, a little scratch, chronic ulceration. And then there's something else I wanted to say about skin cancer removal. Well, it'll come to me.
It'll come back to you.
Lesion removal. I don't know.
We'll just talk, that's what happens, we all jump in, that's why we call this a roundtable, because it's a discussion, and one of us will,
I know. Yeah. So the main risk factor for skin cancer, obviously everyone knows, is sun exposure, but also there are genetic predispositions to skin cancer too. So even if you're somebody who is like, I never go in the sun, I always wear sunscreen, if you have anything, just come get it checked out, because even if you're a person who uses sunscreen, you're a person who doesn't really go in the sun, you still can get skin cancer. So
and tanning beds are the worst.
Yes.
They
People
accelerate.
don't realize the exposure they have driving in their car. You have a sunroof, your scalp is never protected. Like there's so many areas people don't
If you have a lot
realize.
of windows in your house, and like where
You're
you sit in your
exposed.
living room, like
Yes.
if this side of your face is always exposed. A lot of people come in, they have way more sun damage on one side than the other. You ask them if they're driving or where they sit in the house, like. It's
I
the
bet you
little
women
things.
can say, I have more brown spots on my driver's side hand
Yeah.
than I
Yeah.
Yeah,
than I
that's
have
what
on the
people
other
do.
one.
Hands are on the
Yeah.
wheel.
Right, that's
Oh, yeah.
right, so
People
those are,
don't realize right away.
that's right. And so obviously, one of the best things that you can do for yourself is stay out of the sun and wear sunscreens, which we've described. And then, let's just say, for all intents and purposes, that we've ruled out everything and everything looks fine, but you still have some Unsightly spots. Now we get into the cosmetic realm.
The
So-
fun stuff.
So I'm gonna turn that over to Ashley, because she's gonna talk about a couple other skincare products and services that we do to help eradicate brown spots or hyperpigmented areas that we don't like and we think are unsightly. Because we don't cut everything out if we don't have to.
Yes. So probably I'll talk about the procedures first. Like Derek mentioned, the IPL is probably one of the best you can do for clearing up your skin for unsightly sun damage, freckles, age spots. And that's probably one of my personal favorite treatments to get done
Fastest.
after summer. It's the quickest. You don't want to do it now because, I mean, the spots will come back with the sun. You can try to avoid it, but sometimes people, when you're driving, when you're sitting, you don't realize those spots can't come back. But the fall's the best time to do it. And literally, if you have little freckles, like my mom always used to say, like, oh, don't get rid of them, they're so cute. But I'm like, no, they're not cute. That's future age spots, I don't want them. And so basically it's like that intense pulse light therapy, and the light is helping to take away that pigment, and it's really cool because they look a lot darker and then they peel off like a couple days
Freckles
later.
fall off.
Your freckles will fall right off. I swear it's the coolest thing, but I have weird fascinations with stuff like that. And then also too, we have a wide range of chemical peels. Jesners are really popular too for brightening the skin. We have different strengths. We have just a standard one. We also have a modified Jesner too, which is a little more intense. You peel a little bit more from that one than the other one, but if you didn't want to do the lasers, the peels are a little more affordable. They just take a little bit longer to see results, whereas the laser is a little more instant. You might need 3 laser treatments as opposed to maybe 6 to 10 chemical peels, depending how severe your sun damage is. And then you always want to make sure your aftercare is on point too. So one of the things that I love about Kalini MD is that it's all pharmaceutical grade products. So it's unique in that way. We have our own medical pharmaceutical chemist that formulates all these products, and there's with certain ones different strengths that you can't find like at the drugstore, Ulta, Sephora. So one of like the holy grail products is our vitamin C's. We used to have just one vitamin C, but we have a new one that we have that I'm absolutely obsessed with. So the first one, our original one, is a brightening vitamin C serum, and that's its main difference, is it brightens. And also too, with the vitamin C's, they are anti-aging, but they claim to be, but this new one that we had formulated is actually a little bit more targeted towards anti-aging versus the other one where it's just a little more for brightening and hydration. But the main thing with the two of them is also those things that we don't really think about, free radicals. So that's what's causing a lot of damage in your skin too that people don't realize because you can't see it. Just like on a cloudy day with sunscreen, you can't see the sunshine, the UV rays, they're there. So what's happening is when you put it on your skin, so we'll talk about the brightening one first, you put that one on in the morning. That's the other difference, is you want to use the brightening one for the morning because what it's doing, you put it on and before all your other products, because you want it on a clean surface so it can get the most absorption, and it's going to help protect your skin against aging, skin cancer, photo aging, sunspots, all of that bad stuff that's actually causing the damage in the skin other than the UV rays. And if you kind of look at it, they did a experiment where we had an apple and you cut it, each one, and you put some of the vitamin C serum on the other apple, leave the other one with nothing on it, and it oxidizes, and you could see the damage and the brown spots on the one apple versus the one with the vitamin C serum had no brown spots on it after like a half hour or so. So that's a good depiction of free radicals. And then the nice thing about our new one is it has lavender in it, so it's more calming for people that have more sensitive skin. Rosacea too, it's good for because of that lavender calming agent, and it's a faster active ingredient that will help protect your skin faster than the brightening one. And you can use that new one in the morning and at night. So what I like to do is I like to use the brightening in the morning and then use the other one at night, and then you have a nice vitamin C combination. And they also both smell really nice too. A lot of people like their products to smell good. So one smells like lavender, the other one smells like orange peels, which is really nice. And then we also have the kojic pads like Derek mentioned. Those are really good too because I'm somebody who struggles with hyperpigmentation. I've always when I was younger, when I didn't know any better, I would be out in the sun a lot and sunbeds when I was in high school, and then I went to school for skincare and realized that was the biggest mistake of my life. But so we worked on brightening up my skin, and one of the things I used at home, like the first year I started working here, was the Kojic pads, and you can get them. We formulate them in-house. But the nice thing about them being that we are a medical center, we can formulate them with hydroquinone. Some people are allergic to hydroquinone, and it could be you want to do it in small doses because too much could be bad. So we just do a little test spot usually to see if you don't have any reactions to it. If not, you can just formulate them with just the Kojic, and it's a natural brightening agent, but also you can add the hydroquinone for a little extra kick. And using all these brightening products and really helping keeping your skin not only looking pretty, but also protecting it. That's the main part too.
For sure.
I think that what I would like to say, because when I hear it, I try to always think about our audience as well. So a couple things that I heard. First of all, people don't really know what Kojics, glycolics, retinols, all these products are. These are all professional ingredients that help maintain the clarity of your skin and the even pigment of your skin. So they're addressing it. Once you have pigment in your skin, and correct me if I'm wrong, you always have it. So you're always trying
You're treating the
treat it.
symptoms.
You're
Right.
treating the symptoms. You always
The
have it. The sun-
melanocytes are permanently
Right.
damaged.
Exactly. So that's
It's an
one thing.
ongoing.
So there are
It's
multiple
ongoing.
products that we recommend, and that's one reason you want to go to a professional, is so that you know which of the products might be the best for your skin. So the hydroquinone, all of those things are bleaching agents to the skin that help keep the skin smooth. The other thing that Ashley mentioned, and I think we mentioned this in another program about free radicals. So when you're talking about products that are antioxidants, those are products that are addressing free radicals. And what the heck is a free radical? So if I'm remembering my chemistry, and one of you that's more recent in school might have to remind me, all matter is made up of electrons, protons, and neutrons.
Yes.
And what we have to do is make sure that they're balanced. So there's always a proton for every electron. When there's an extra electron that gets kicked
Ruin
out,
everything.
it goes out in the air and it circles around, and it's that little baby electron that we can't see that's called a free radical. That free radical is what causes rust on the metal that you see
Oxidation
outside,
stage.
or what degrades material, anything. It's that little guy
Doing it
that's
to your
flying
body and
around
your skin.
and does it to
around.
your skin. So when we talk about free radicals, that's what we're referring to. And so I think that that's one of the things we also present, is that medical background of information. So I tell all patients when they come, if you don't know something, call us. I'm a free information highway. And so is the whole team. So, and if we don't know something, because we don't know everything, we will make sure that we find it out for you. So I think that that's the best thing that we can do. And I'm not sure if we have anything else more to say today. And I know we've been talking off like crazy. I want to just make sure that everybody has spoken what they'd like to
I
say.
think just talking about the importance of sunscreen every day.
Oh, yeah, I did want to discuss
Yeah.
this sunscreen.
Yeah, and also on your lips too, which is like the most forgotten spot.
Which we have a
We
product.
have a great
Toenails
one.
and fingernails
Yes,
as
Yeah.
well.
toenails,
Yeah.
fingernails, lips, eyelids, ears, these are all places to look at.
Top of
And
your ears.
we actually
That's
have
why I have them.
a lip treatment that has a safe physical block in it. It's a plumper and a block. So if
I
you're interested in
love
that, we do carry
Love
that product. I don't know, can I talk about a little difference between sunscreen?
Oh yeah, I just want to say the lip plumper, the one that has sunscreen in it, and
So
it's
good.
it's a clear lip gloss, which I love clear just because I feel like I'm always just running around busy, and with the masks too, I hate when I get the lipstick colored in my mask, so I love the just clear, it's clear lip gloss, and it's a plumper, and it has sunscreen, which I just
And
love.
hyaluronic acid.
Yeah,
And
so
that's
it's amazing.
Listen,
Yeah.
when you can marry professional stuff with cosmetic
Yeah.
stuff and get that cosmetic,
Perfect
combination.
it's the best. It really is
See,
the
what
best.
I like too, because of that hyaluronic acid, it also has a biomimetic
Lip
agent in it. So like when you have the hyaluronic going in, if you get lip filler like I do, I feel like I can go a little bit longer because it has that plumping and your
Accentuates it,
body has a memory, so that plumping kind of stays for a little bit while, like when you keep using it.
Actually,
so.
you have lip filler?
No.
We're just teasing.
I know.
So yeah, just on the sunscreen before we go with prevention, because that really is the whole thing. And just because you have dark skin, I tell my father's wife this all the time if she's watching, just because you have that beautiful brown skin doesn't mean that you are not susceptible to sun cancer. Or skin cancer. The sun is damaging your skin just the same, it's just you're not seeing this, you're a little more tolerant and you're not burning in the same way. And putting your sunscreen on at 8 a.m. and then laying in the sun until 5 p.m. and not applying is not going to prevent the skin cancer. So what you have to do, most of them have an indication of how many minutes it might last, and you're going to have to increase that by whether you're in water, depending on its water resistancy or how the formula is made. Ours are typically 80 minutes. So when it says that 80 minutes on there, you have to reapply within that time frame. And in the Kalini MD products, because they're professional and they're hypoallergenic, we like to combine a physical sunscreen with a chemical sunscreen. So a physical sunscreen is typically a mineral. You'll hear the words titanium dioxide or zinc. What that does is it sits on the skin, and if you looked in a ultraviolet light with your eyes, you would see that it just totally blocks out. The skin looks purple. Now, when you put a chemical sunscreen on, those can be a little bit more irritating for your sensitive skin people, so we have both. The chemical sunscreen radiates energy on the skin, blocking the absorption of the sunlight. So it's not as powerful as chemical sunscreen, so you really do want to look for that titanium or the zinc in a product. And our Kalini MD pharmaceuticals actually have 2 of the highest zincs on the market. So we have a 16.2% and we have a 13% zinc. So you're almost at a total physical block of the sun once you put that on. You also want to apply your sunscreen to clean skin about 30 minutes before you go out into the sun to allow it some time for absorption and for it to work, and make sure that you're consistently reapplying. If you're sweating, reapply as much as you can, because it's coming off and it's not doing what you want it to do.
And one other thing with sunscreens, they do have an expiration date.
Yes.
Typically, the one you used last season is not going to be enough
Yes.
for this season. It's not
Very
going to
good
be any
point.
good. So
And they do,
People pull that
it's been in
sun
your,
baby out
your
from
luggage,
35 years
it's
ago.
been old and it smells
It
already.
doesn't work.
Doesn't work.
So the rule of thumb is every season get a new
Get a fresh
sunscreen.
one.
And if you can combine sunscreens with a I have a sunscreen that has a tint in it,
Foundation.
which is
Yeah.
like a foundation, and I go out with that. I don't have any makeup on right now, but I always have sunscreen on every day. I put that on, I'm religious about it, and I might look pasty to everyone. I don't have that glow,
It's the prevention.
but yeah, it's about the
And
prevention.
preventing
Protective.
those brown spots from coming back, because we do IPLs on a few customers have had this happen in the past, and anyone who's had this experience. Again, we're treating the symptoms of something that's been damaged for a very long time. So the brown spots, those melanocytes are permanently damaged. We take away the symptoms, that will come back with sun exposure. That's not anyone's fault, it's no fault of the machine, it's just that you're gonna bring it back if you continue the habits of sunbathing or sun worshipping without protection.
So get a good
So
bronzer.
cover yourself up.
Cover yourself up, get a good bronzer.
And there was a good point that Susan brought up. Some of my clients say, oh, my sunscreen is in my makeup. That's probably maybe 13, 14 SPF. That's not enough for
And you have your
summer.
makeup on 13 hours a
Yeah.
day.
Right.
Yeah, so, you need, and I'm sure you covered it, but the sunscreen should be the last thing on your face, and then you could put your makeup on. And somebody said, oh, well, if I put, my makeup has 18 and I put a 4 on, is that a 22 SPF? And it doesn't work that way.
No.
That's a
No.
very good
They do
point.
not
And-
combine.
And we introduced Karen before, she was our MPC for a while, but she got back with us, but, that's a really great point. We don't add up 50 plus 50 because 100
It doesn't. Not the
work
way
that
it works.
No.
And then fingers and toes.
Yes,
Fingers and
toes.
toenails are,
Yes.
that's how Bob Marley died. I don't know if anyone knows that.
His toenail
His
bed, he
toenail
had
bed.
melanoma.
So if you see brown stripes across your nail, or you see pigmentations that are odd looking in your nails, they're probably not supposed to be there, and it's actually a pretty easy procedure. They take the nail, they biopsy what's underneath, and your nail does grow back. So that is
How many
something,
people put sunscreen on the bottom of their feet and they flip
Yeah.
over? That's another area that, you know.
gotta check all over them,
You gotta
it
check
can be
all over.
anywhere.
That's right, that's right. Anybody else have anything else they wanna add? I know Karen's a little bit, but, at a loss because we were talking for a good half an hour already. So I think we have most things covered,
Yeah.
anybody else?
If you have anything questionable,
Yeah.
come on in.
Yeah,
So-
please, yeah.
We have not picked out our topic yet for our next month's roundtable in June. So anybody, we actually take some suggestions as well. So if anybody has something that you'd like us to speak about and you'd like to learn more about it, so do we. So hopefully after this day, you will go out, put your sunscreen on before you Cinco de Mayo and have your margarita tonight or your
Yes, and
or
like
your
check all
party.
your lesions, and if
That's
you have
right.
something suspicious, come make an appointment.
That's right, that's right. That's right. And that's, I think, says it all, and I think that's what we're here for, great skin, good skin care, healthy skin, beautiful skin. And until next time, everybody, we'll see you